Our lecture today is hemostasis. What's the meaning of hemostasis, or what's the aim of hemostasis? The aim of hemostasis is to stop bleeding at the site of injury. And in fact, we have primary hemostasis, which which end with the formation of a platelet plug. And if the platelet plug is not enough to stop the bleeding, it's need to be it will be very important to strengthen the platelet plug, and this is done by the fibrin thread, which is formed by the secondary hemostasis. So when there is injury to the endothelial cell of a blood vessel, and as you know, the blood flow through the blood vessel, when there is injury, the blood comes out through this site of injury, and bleeding, if severe, it will cause drop in the blood pressure. It might cause shock, and it ends with a serious complication and even death of the patient. So the blood undergoes a condition of hemostasis to stop the blood loss. And at first, we have the process of vasoconstriction. This vasoconstriction is important to make the hole of the blood vessel smaller, to decrease blood loss, and this is done by many factors. First, we have a nerve reflex, and another thing is the endothelial cell, which are present in the blood vessels. Under normal condition, the endothelial cells secrete nitric oxide and prostacyclin, and both are a vasodilator, because when there is no injury, a vasodilatation is important to maintain the flow of the blood through the blood vessels. But when there is injury, the endothelial cell secrete endothelin, which is a vasoconstrictor, causes vasoconstriction. And the other factor is the myogenic contraction of the smooth muscle. So all these factors causes a vasoconstriction to decrease the lumen of the blood vessel, and then decrease the amount of the blood loss through the site of injury. The second step is the what we call the primary hemostasis, or platelet plug formation. And the platelet, which is normally circulating through the blood vessels, when there is injury, there is exposure to the collagen fiber. And an important factor which is secreted by the endothelial cell, which is called von Willebrand factor, this factor have its receptor on the platelet. So the exposure of collagen fiber and the secretion of von Willebrand factor by the endothelial cell will cause the platelet to come to the site of injury, and this von Willebrand factor bind to the receptor of on the platelet, and the other side on the collagen fiber. So when the platelet binded here, it will causes changing in the shape of the platelet, and then there will be activation of the platelet. So first we have platelet adhesion. The platelet are calling at the site of the injury, and second step is the change in the shape of the platelet. Then the platelet are activated, and when they are activated, the platelet, in fact, have many intracellular granules and many receptors. So when they are activated, their granules are excreted. And one of these granules, which are present in the platelet and they are secreted when the platelet activated, is serotonin, which causes a vasoconstriction of the smooth muscle. And the other is adenosine diphosphate, which activate more and more platelet to come at the site of injury and causing what we call aggregation of the platelet. So the platelet aggregation is due to secretion of intracellular granules like adenosine diphosphate, which causes aggregation, activation and aggregation of other platelet. Also, the platelets secrete calcium, which is very important in activation of the clotting factor in the secondary hemostasis. Also, it secretes thromboxane A2, and this causes vasoconstriction and activation of many platelet and causing platelet aggregation. So, in this step, the platelet adhere at the site of injury, change its shape, and then we have platelet aggregation. And this is what we call the platelet plug formation, because the platelets aggregate together at the site of the injury. Now, as we said, the platelet plug is not strong enough, and sometimes when there is a mild or a small injury, the platelet plug might perform a role in stoppage of bleeding. But when the injury is severe, the secondary hemostasis comes to play, and this is done by the in the secondary hemostasis, the aim of secondary hemostasis to make the platelet plug more stronger, and in order to form the fibrin, in order to form what we call the fibrin meshwork, which come in between the platelet. This is the fibrin meshwork or fibrin thread, in order to strengthen the platelet plug. And this is done to stabilize the platelet plug, in fact. And this is done by the activation of fibrinogen to form fibrin by many coagulation factor. And in the activation of clotting factor, in fact, when a factor is activated, it will activate another factor and so on. And this is called a cascade of clotting factor activation. And this is the activation of a clotting factor is done by there is what we call subendothelial collagen fiber, which is exposed at the site of injury, and in fact this cause activation of intrinsic pathway of clotting factor. So in the secondary hemostasis, in which there is activation of a clotting factor, we have two types. We have the intrinsic pathway and the extrinsic pathway of clotting factor activation. So in the intrinsic pathway, we have the due to the exposure of subendothelial collagen fiber at the site of injury, there will be activation of intrinsic pathway of the clotting factor. And for the extrinsic pathway, we have what we call a tissue factor, which is released from the endothelial cell at the site of injury, causes activation of the extrinsic pathway of the clotting factor. And in order to understand the extrinsic and intrinsic pathway, in fact, the intrinsic pathway, which is started with activation, as we said, the exposure of subendothelial collagen fiber, it will cause activation of the due to the exposure of at the site of injury, exposure of subendothelial collagen. It will cause activation of factor 12, and when this activated, it will activate factor 11. When this activated, it will activate factor 9. And when factor 9 is activated, it will activate factor 10. When factor 10 is activated by the effect of factor 8 calcium, this will cause activation of factor 10. Now, regarding the extrinsic pathway, when there is a tissue damage, causes activation of factor 7. Activation of factor 7 cause activation of factor 10. So at this step in the intrinsic pathway and extrinsic pathway, when we are reaching the activation of factor 10, here we have what we call the common pathway, because in the intrinsic and extrinsic pathway we have at the last step activation of factor 10. When factor 10 is activated by effect of factor 5 and calcium, here we have factor 2, which is called prothrombin. And when prothrombin is activated, the thrombin is formed. The thrombin causes activation of fibrinogen